ADHD is attention deficit hyperactive disorders, and ADD is only attention deficit disorders. ADD can lead to learning disabilities, but ADHD associated with mild to moderate mental retardations. The both three causative factor for both it is delay milestones. There's multiple causes of the delay milestones that can be either is a prenatal or natals or sometimes can be postnatal. So treatment will be depending on the underlying causes. First, if there are other problems like this, other complication during the birth, so that need to be corrected immediately with the found. But the maximum scenario that does not happen it. The maximum healthcare professionals, even also the family members, parents, relatives, they need to wait. So, young development is slow. When the age grows up, it will become alright. That is a wrong conception we have in this. Because of that wrong conceptions, what it will lead to the either delay milestones or other kind of physicals and cognitive disabilities. Brain grows, particularly maximum growth occurs within 5 years of age. But we keeps on waiting. Yeah, once the child will become grow after 5 years, then everything will become alright. But by the time the brain growth, the rate of growth of the cerebral parenchyma, so it will slow it down. So once it will slow it down, the underlying causes or factors which cause this delay in the growth of the brain, that will start showing the symptoms like behavior. Example, less of sitting spans, increase the anxieties, screaming disorders, avoid to take any kind of command or instructions or obey or listen to any kind of instructions. So overall that means the child what wants, they has to do that. If someone else will command to or instruct to do that, so then they either they do it a short span or they simply does not take that instruction to follow that. So that will lead to as ADHD and ADD. By the time the parents started consulting, so only after the age of 5, so it will be late. Why it is late? Because the brain growth starts slowing down after the age of 5 years. The rate of the growth of the cerebral parenchyma. So that means it's a golden time to treat this kind of disorders. It is within 5 years. The simple answer, basic things answer. We don't get any symptoms, major symptoms till the age of 5 years old. Never neglected. But the other symptoms like this, slow in growth, slow in achieving the milestone like that, sitting or standing, will have the delay of 1 month or 2 months like that. So the delay we never notice that. Yeah, child is you have some problem, childhood problem, it will by the age will come, so you will start slowly, you will get it normal. So that is misconceptions we have it is at the present scenario in our societies. Even maximum this one, the family doctor or physician or pediatrician, they advise it is nothing to worry, it will become by the child grows, it will be fine. When it grows, everything, all the symptoms starts coming out. So when you observe the symptom, then we start visiting the doctors. So that then by the time it will be too late to treat to the pain. Because brain started giving response when that is a difference between both your mental growth and physical growth. So till the age of this one, tell example till the age of 5 years, it was very minor difference. There is a cognitive brain growth is like this, physical growth is like this. So it was going in this scenario. So that means you had a only slow little bit of delay in all the activities. When in case of after the age of 5 years, the growth brain growth slows down. It grows, but in fact it slows down. But the physical growth, as usual, it grows up as the time passes. So that is important features why you will get the symptoms only at the age of 4 to 5 years. So for any kind of problems, always prevention is better than the cure. So we are waiting to come solve the problems. We know the child has some weakness during the either the birth or during the birth or after the delivery. So if you treat that in that stage, then you will avoid getting the symptoms. It is simple way of treatment. The brain is growing slow. We know that because of some other pathological conditions. It can be either it is before the delivery, take it is in this one IUGR, intrauterine growth retardations, or in kind of this the birth asphyxia, so will have the less of oxygen supply. So other factors, there is multiple factors. So if you treat that, it will just enhance the brain growth process after the immediate after the start the delivery by giving one of this one this one neutrophils or citikollins, which increases the neurotransmissions, and one is increases this growth of the cerebral parenchyma. So then what happens? This again slows this, increase the growth of the cerebral parenchyma. So by the age of 2 to 3 years, we'll find the child is everything normal. Instead of having the delay, we'll have the normal. So that is the first approach to not to get this kind of disabilities. And once you will start getting the problems, even to correct it, it will be 100% is not achievable. Why? Because the brain growth, how much will give the stimulation, it doesn't give that extent improvement. So treatable only be less within 5 to 6 years, lesser than that. Okay, that is first part. Second part, okay, she's now we did not notice it. Okay, after the age of now the child starts slowly growing it up, giving him different behavior scenario or disease symptoms. Then what we need to do it is, even also it's late, we cannot able to leave it in that situation because it is a biological symptoms, but biological comes from the symptoms of the slow in delay in growth of the cerebral parenchyma. See, again same things what you do it is at the age of before the 5 years, same thing we need to do it is after the 5 years when we start growing, but not on that regular ratio. Because why? If you will give increase this one same things, if I increase giving the citicolis, this our nervous system will be something. The junction of each nervous system will have something. Both these things is that way. So that is in between there will be space. Here you can see. But so anything will give to stimulate this one. So it again increases this outflow of the signals. If I give a acetylcholines, which will stimulate or neutrophils, so it will increase this one synaptic junctions. So that way, what it will lead to, it will maybe it will aggravate the behavior disorders because it increases the signals. So it will be a modified dose. Modified dose only giving the acetylcholine, but not in case of CNS stimulants like methylphenidate. Everybody that do it is giving the methylphenidate. If you just prescribe it, the child will become complete because methylphenidate whatever he complete starts blocking the signal. So in that way, what happens it is the child will be for the time being it will be inactive, but slower his activities. But you are even also when indirectly you are decreasing the cognitive functions. We are reducing his behavior, but same also we are reducing, you are making him decline his cognitive functions. So one other way we are going to just for temporary we are treating it is. So that means the child will become going to be completely disabilities in future. No, we should not do as that things. We need to give the same the CNS this parenchyma growth enhancers and neutrophils in modified dose. Observe the child behavior, give. Observe the child behavior, how the child behaving is, then give. Then additional to that, yeah, you need to go for the conservative managements with the behavior therapy, behavior modification therapy and cognitive stimulations. So that is very important things. And during this one cognitive stimulation or behavior stimulation, always you need to make sure we should not make his anxiety disorders aggravated. That is everybody. No. Whatever something he's asking, we need to give it is. If we give it, it will become addiction to that. Then we'll keep on demanding that things. Then what everybody they do it is, no, you should not do that. The child is something to we, first term we said, no, you should not do that. Then in that way, what you will do at is you are increasing this outflow of this one both pre in synaptic junction. You are increasing release of the acetylcholines. So that again will keep on continuing the internals desynchronization of the nervous system. But if you say yes, so the anxiety does not reduce, then you are synchronizing the synaptic junction here. So that means we are not increasing the tendency of the behavior problems. In other, that is in first part. Second part, we are giving additional to that. We need to achieve this one is cerebral parenchyma and full growth. So we need to keep on giving. So this scenario, see there is a little bit of less of hypoplasia. So we need to increase the growth of the cerebral parenchyma. Again, we need to keep on giving this with acetylcholines and piracetam in modified dose. So that will slowly bring the hyperactivity down. So once we start hyperactivity will down, then obviously you will start listening all the comments. You will start observing the society, this one surrounding what is going on, how it is. Then you start getting learning faster. So once you start learning the child faster, then you don't find any kind of aggressive behaviors. That's it. So treatment will be different approach or the different level of the problems. So if we treat in seeing the intensity of the behavior issues as per the age then it can be treatable completely because it is more of related to the behavior. Okay.